Auscultation is the act of listening to sounds arising within organs, as in the lungs or the heart, as an aid to diagnose treatment. Today, we'll be specifically talking about lung auscultation. The purpose of lung auscultation is an evaluation technique used to confirm the findings of chart assessment and inspection, to rule out cardiopulmonary dysfunctions, and for the reassessment of a patient's ventilation following treatment techniques to improve bronchial hygiene.
Auscultation is performed in a quiet environment with a systematic approach, moving anteriorly to posteriorly. The patient is in proper positioning, ideally sitting or standing, and the stethoscope is placed on bare skin. The therapist performs this before treatment and during and after treatment if deemed necessary.
First, with asking consent to treat the patient, the therapist explains what the procedure will be. If the patient is able, the therapist puts them in an upright position with arms folded across their chest. The therapist cleans and warms the stethoscope. The patient coughs to clear any secretions, and the therapist puts the stethoscope on their anterior chest and moves in a pattern from side to side to ensure all bases of both lungs are covered. Each position should be listened 2 to 3 breaths while comparing sides, and the patient breathes through their mouth.
The things you assess while performing auscultation are the rate, which is the number of breaths per minute, the rhythm, which is the regularity of the pattern, the depth, which is the amount of air exchanged in each respiration, the character, which is how it differs from normal, and the type of breather, which is chest or abdominal. Here we have Tracy being a chest breather, and here we have Tracy performing the actions of an abdominal breather.
Conditions of respiration are dyspnea, which is labored breathing during rest, orthopnea, which is difficulty breathing, and apnea, which is absence of breathing. Abnormal breath sounds include 2 categories: discontinuous, which would be crackles, rails, and pleural rub, and continuous, which would be wheezes, rhonchi, and stridor.
Clear to auscultation, and that the patient has normal breath sounds. If this is the case, the therapist would continue on with treatment. However, if the patient had any of these other abnormal breath sounds, the therapist may need to refer them or continue treatment with monitoring and caution. In the case of stridor, this requires immediate medical attention.